Hello and welcome to another in the series of You Ask, We Answer, where we're answering some common clinical questions that have come through to us here at Oscar. I'm Anita Morton, I'm the clinical support nurse for Oscar.
And I'm Valerie Daly, I'm an independent tissue viability nurse who's working with Oscar.
So let's look at another of the questions that's come through to us. And this was all around mattress selection. So how do I select the best mattress for my patient? Well, in all honesty, this will depend on your patient's condition, their risk assessment score, their level of comfort, and also your own clinical judgment. And it will also depend on manufacturer guidance too. It's really important to obviously make sure that you look at the manufacturer guidance on the mattresses that you're using, so that you're using them correctly and in accordance with how they've been selected and manufactured. So at Oscar, we use a colour coding system to enable our customers to select the most appropriate mattress. And you can see those colour codes there on the screen. So we have a simple colour coding of green, amber and red. So green is prevention, so we're looking at up to high risk prevention with any of our mattresses that has a green stamp on it. Amber is looking at sort of superficial risk, so superficial category, of pressure ulcer, so up to category 2, but again up to high risk prevention. And then our red stamp looks at high risk, so it will be high to very high risk and up to category 4 pressure damage. So all of our mattresses will have that colour coding system on, so it just makes it nice and easy. But like I said, you need to look at your manufacturer guidance and instruction, but also use your risk assessment and clinical judgment as well.
Yes, and it's important to look at some of the key things when we're selecting the mattress. So we would look at whether the surface that you're selecting meets the clinical needs of the patient. We need to think about things like pain, mobility, access, environment, patient's preference, and all of those kind of things that we need to put together. And then we need to think about, what is the surface that can provide the most therapeutic pressure relief for that patient, given their current condition, their risk assessment. We also need to think about the psychological and psychosocial needs of the patient. So, when we think about psychological, it is difficult to go onto a system that moves underneath you, isn't it, Anita? So we need to make sure that the patient is, that we communicate really well with them, that they understand the rationale behind why we need to increase or put them onto specialist equipment. We also need to think about the environment that they're in. This may not be relevant to care homes and nursing homes or hospices, but it might be very relevant in a community environment where, is it safe to put it in? Is there risks around maybe smoking or damage or pets? We need to think about whether the plugs are accessible. We need to think about whether we have to put this onto a divan base or a home hospital bed base. So there's a few of those things that you need to bear in mind. Is it immersive and enveloping? And we're going to answer a question a little bit later about immersion and enveloping. So that just really means does it support the patient properly? And does it spread out the pressure underneath the patient to all areas of tissue that are in contact with the mattress? And the microclimate, is it does it work really well in managing that microclimate? So does it stop the patient getting hot and sweaty and allow the skin to breathe? We don't want moisture to build up under a patient, because we don't want to be asking the skin to do extra work when it's already trying to keep on top of its own repair. Is the patient easy to reposition on the mattress? How mobile are they? What else do we need to put in place, like perhaps slide sheets or easy sheets or things like that? Or actually, is the patient self-mobile but needs that support under them? So for example, with paralysis, when they're transferring out of the bed, we need to think about the edge of the mattress and whether that is firm enough to give them the support that they need to move across. And we need to think holistically. We need to look at absolutely everything that's involved in that. We need to also make sure that we document our choice. So we're hoping that this has answered your questions. It is very multi-layered, isn't it, Anita?
Absolutely.
And I think that if you are struggling to select the best mattress, then you need to speak to somebody who either has a lot more knowledge around mattress selection, or even talk to the companies that you're used to dealing with, and maybe talk to the likes of you, Anita.
Absolutely.
And see if together you can figure out the best mattress for your patient. Okay.
So thank you for listening and watching, and we hope, like I say, that's answered your question, and do join us again for some more You Ask, We Answer.
Okay, bye.